Today we will be talking about this interesting topic: language, speech, and speech disorders. These topics are very broad and they encompass a number of areas in social sciences and the psychology. But I would restrict myself to the concerns of a physiologist. Okay, so now I have here one very nice painting. He is a Socrates, maybe 300 or 400 years BC. He was accused with the molestation charges, and he was given a choice of apology or defense. That means he had two choices. One, either to apologize to the king or to defend his innocence. Here he is defending that particular incident. That is the picture of that, and he is one of the greatest orators of the world. Even ever since then, maybe he may be coming in within the top 10 orators of the. So now, why I am trying to talk about this orator and these things. This is the speech. The speech wins the battle. Speech wins the heart. Speech wins the money. Speech wins the kingdom. You know, if you are a good speaker, even you can try to impress upon people and try to be the somebody. You see any of the current global leaders anywhere, whether it is India or United States of America or Britain or any other state, all these leaders have one good quality. They are good orators. They speak well. So now, so that means the speech is that type of what I will say, an instrument in which we can win people. Okay, with this background, we proceed with the physiology of speech. Before we go to speech, now let us understand what is language. Language is the means of communication within the species and even in human beings. It consists of use of words in a structured, conventional way, and these use of words may be spoken, that is verbal, or may be written, or may be by pictures, graphic. Sometimes we have many graphic presentations, or the person who is deaf and dumb, he uses the sign language. So these are the three ways of communication. The language is communicated to the other. Sign language is also an important means of communication. So the language has been evolved through the alphabets and words, which make the sentences. And these sentences have a rules, the spellings, the pronunciations, and definite order of arrangement. That is what we call as a grammar. But the person who does not know the whatever the formal education, still he speaks the language. He speaks the good language. And sometimes you will be surprised. So that means it is a way of usage of words in the context of the living. That is how I take it. For the language, and you need not to be having a knowledge of the alphabets. That is what I have written. The person who have not taken the formal education also still be a good language specialist. Okay, that is about the language. But the language is made up of a speech only, or the spoken words only. Now, if we come back here, what is the language center in our brain? These are some of the functional areas of the cerebral cortex where there is a language comprehension. So one of those centers is the language comprehension and intelligence center is the Wernicke's area. This is a Wernicke's area in the temporal cortex, just at the angular. This is the angular gyrus, just below the angular gyrus. We have this language area. This is comprehension of the language. So that puts the language all together. So now this language comprehension, it takes the help of these somatosensory association areas. Say, for example, from the sensory modalities here, from the visual aspects here, from the again visual cues for name of the object. So that means it comes with the auditory as well as visual, auditory and visual, put them together. That is a naming. So we try to remember an object, or you remember that you see when you see a caricature of me, you see that okay, it is Dr. Deshpande whenever that picture comes. So like that, that particular naming of an object or a person or anything, it is this is stored here in this. And again, the behavior or whatever the concepts associated with these objects are stored in the limbic association area. This is limbic association area. And this is the process where they will hear the sound and you can identify my voice because we have been interacting and you understand my voice even if you play it and you will be able to listen. So that is the auditory association area that comes with the language. Now the word formation. So that means a particular word formation, word selection comes here near the Broca's area. So this all will be orchestrated. These all things will be orchestrated by a master sitting here. This is the master prefrontal cortex. Yesterday we were talking about higher functions. The language is one of the higher functions. So this is the man has evolved and we have a language and there is a broad understanding. All the languages have alphabets and all the languages have a grammar and all the languages have a pronunciation and a means of communication. So that means this is the master here in the prefrontal cortex that decides or that governs everything. So that is what about the language, and this is governed by the prefrontal cortex. So now I repeat again, this is the name center, the language comprehension area, and the behavior associated with a particular object, the auditory signals associated with an object, and the word selection, and the overall governance by the prefrontal area. Now, which of the cerebral hemispheres? Is it left or right? So it is certainly in a right-handed person, it is the left cerebral hemisphere that have all these properties. I will come about that categorical and non-categorical hemispheres in the middle of the discussion. But this is the left cerebral hemisphere that have stored all these information in relation to the language. Now, what is speech then? Speech is also a means of communication verbally. It is a means of communication verbally. The language is a means of communication, either written, verbal, or graphical, or signs. Here, it is the means of communication verbally by producing the sound waves. That is called voice. And these sound waves are produced in such a way that they are understandable to the other person. Okay, so now every day in the morning I just go through the campus of your AMSR and I see that many birds are chirping around and they produce a different noise at a different context. That means they are also communicating each other. So that means the sounds or the sound waves produced by these animals also have something which we are not able to understand. Anyway, that is a different aspect altogether. maybe that would be in a different perspective. Now, this is the voice or the speech is a highly skilled voluntary act. Because I am speaking to you and I don't see you, I am sitting in front of the computer and I try to give my lecture, and I am already oriented for giving the action. So this is a highly skilled voluntary action. And the speech consists of a group of words organized in a manner prescribed by the language. That means whatever the words I use the grammatical sense associated with the language, whatever the rules associated with the language. There are two components of the speech, the verbal components of the speech and the written component of the speech. So both are written is a graphical or a verbal. So both are components of the speech. So that means we have a, but we usually speak, we always remember a speech is a form of a verbal communication. Now, then how does it work? It's a planned, coordinated action initiated by the neural parts in the brain and the speech is produced by the musculoskeletal system present in the neck or the oropharyngeal part. So that means that musculoskeletal system is situated in this, what is that, voice box. Voice box, we say that the laryngeal component. So now, what are the components are required for this thing? One, the nervous elements and centers. That is the thought, the planning, selection of a speech, and sequencing of speech. So that means when I'm talking to you, even whatever the words I utter, they are all coming with these particular four structures. That means there is a thought associated, though I may not, they cannot be split in that way, but there is a planning associated, what words to be chosen, and then select how much I should emphasize or how much these things, that is the type of selection there, and sequencing of the particular narration what we are trying to make. It has a sensory component, it has a motor components. So sensory components means I get the inputs, either proprioceptive inputs, the audio visual inputs, so that is a sensory component. The motor component is the production of the voice. And these things are integrated, the sensory and motor components are integrated in the center in the brain. So what I want to say that there are sensory component that is in the brain, there are areas which process this speech in terms of the meaning and its cognition. And in the brain, there are areas in the cerebral cortex which excite the motor the components, especially the muscles of the voice box or the oropharyngeal part, and that is where in the brain that is there. So then these two things, sensory and motor, they are coordinated when we have a meaningful speech. So now we have the production of a speech requires a musculoskeletal system. So that means this is a neural element. So this is the musculoskeletal element. In this musculoskeletal elements, we have verbal communication. For speech, we should use the respiratory system, because this is the windpipe which blows the air, and when it blows the air, whatever the sound produced or vibrations produced by the vocal cords, they are getting out of the mouth. Then we have the laryngeal system, that is the vocal cords, and then there is a articulating system. Now, then for a graphic, this is for a verbal part of the communication. For graphical communication, we have the hand movement, especially writing, the fine movements of the fingers, and even orientation. You just see that writing does not only the hand, even entire body, the pectoral girdle is involved in addition to the neck and the eyes. So you just look at that. When you are writing, you are using all those. That means there is a posture associated, and it is not only pure hand movement or a fine movements of the fingers. In associated, the postural adjustments are also happening for the graphical communications. Now, going further, what is articulation? Because I mentioned about these components, the respiratory system and laryngeal system. I will not emphasize on these two systems. I will just go with the articulatory system, which is less covered elsewhere. This is the what is articulation? Or we use the phrase, this person is very articulate. That is the phrase we use. That means he's outspoken, he articulates. And here is a person who articulates very well, precise. So like that, these are the terms used for the. So now this is a act of production of a voice, is articulation. It involves the muscular movements of the mouth, tongue, larynx, vocal cords. Mouth, tongue, larynx, vocal cords, and so forth, that are responsible for intonations, the timing, the rapid changes, the intensities, and the sequential arrangement. I need not to explain each of these words, they are self-explanatory. Intonations, that means change in the tone, or timing, the spacing between, or the rapid changes, whatever we make the changes between the words, and the intensities, some words we stress upon, and sequences of the sounds. In this thing, the neural components involved are the facial nerve, the nerves supplying the laryngeal muscles, and their centers in the medulla. And even some of those spinal areas are also involved, because the neck muscles are involved in producing these things. Maybe besides the facial nerve, we have these movement of the jaw, movement of the lips, then the pharyngeal muscles, the glossopharyngeal nerve. So these are, I have not mentioned. That is why I am telling that is laryngeal nerves, pharyngeolaryngeal nerve, they are involved. Then all these things are coordinated by the motor cortex. That is what we have thought for the voluntary motor action. That is the premotor area, supplementary motor area, the motor area, and then the basal ganglia, cerebellum, and all those components, they are involved in producing the voice. So now in the next, there is a cerebellum, basal ganglia, sensory cortex, all are involved in sequence, as we have thought for the voluntary actions, to produce the contraction of the vocal cords, and even movement of the entire oropharyngeal components. So damage to any of these regions may cause loss of speech. If there is a paralysis of the or a cutting of the laryngeal nerve, which is supplying the vocal cords, what is called a recurrent laryngeal nerve, so that means he may lose the voice. So that means, so you can just think all these areas are important for production of speech. Now, I will just go little extra with the articulatory system. The production of a voice refers to the movement of one structure against another. That means it's not only the vocal cords. If the vocal cords contract does not happen, it's the vocals contract at a particular way or a particular degree, and the wave or air coming out of the windpipe or the trachea are trying to push that vibrations out. So that is what the articulatory system is about. So this is called a supralaryngeal. So that means it's not only the vocal cords, it is a supralaryngeal component that is important. It consists of muscles, bones, teeth, and cavities. Muscles, bones, teeth, and cavities. I will not go into the detail because each one of them are distinct topics. So now that entire thing is called as a vocal tract. Now it has, this vocal tract has movable parts and a fixed parts. The fixed are the teeth, the incisors, the hard palate, and the alveolar ridge. So these are the ridges which makes these are fixed components. The movable parts are lips, the tongue, the soft palate, the pharynx, the mandible. So that means we have a movable parts and fixed parts. Then you just see that this is what we see as a vocal tract. This is a vocal tract. The entire thing is a vocal tract. We have mentioned this is a nasal cavity. Again, you have the nasal cornua there. So this concave, what we call as a nasal concave. So the superior, middle, and inferior nasal concave. So this is a cavity. Then this is a oral cavity. This mouth is closed. So this is a oral cavity. Here is the tongue. This is the pharyngeal cavity. So whatever the sound produced here, it has to pass through. You must have seen whenever you are having a cold, your voice is altered. Maybe you don't have that laryngitis or the vocal cord infection. You may have something with a rhinitis, that is with the nose. Still, you have a sound quality is changed. Or if you are having a problem with the swallowing, so your voice production may also be pharyngitis. If there is a pharyngitis, you may have the voice alteration in the voice production. So that means the whatever happens in the vocal tract also will alter the voice production. Now, just coming back to the arts of speech production. So that means in the speech consists of use of words, and these words have vowels and consonants together. So now when we are talking about the vocal tract and how this vocal tract deals with the vowels and consonants, here I'm just trying to give you regarding the vowels, how this is been. So now here if I give you an example here, A in cat, E in keep, I in bike, O in soon, or U in cute. These are the vowels there. And when we are using or pronouncing these vowels, we use the tongue movement. You can just try to look on that. When we use the tongue movement, that would produce, because of the respiration and vocal fold vibration, vocal cord vibration, that would produce the sound. This is how the vowel movements or vowels are pronounced. Now, if you are coming back with the consonants, consonants are these remaining, leaving that A, E, I, O, U in case of the English alphabets. So the remaining alphabets, remaining 21 alphabets are the consonants. So now how, just I'm giving you here example, the pear or a cup, P in pear or cup, B in bad or crab, T in tall or hit, D in dark or head. So these are the consonants. When I am using that consonants, so now what I use the fixed components. In case of vowels, I use a tongue. Here I use a fixed component and movable articulators. So that is how they are pronounced when we try to pronounce at them. You can just look at them, sit back and try to analyze. And here the respiration is used, and vocal cord vibration may not be as much. But as far as the vowels is concerned, vocal cord vibration becomes imminent or important. Now, moving on, because I leave that English language there and I move on to the physiology. So now these are some of the centers for the speech production. So now I'm asking the question to myself, what are the speech centers in the brain? Now I have listed here one speech center. So this is a Broca's area, Broca's speech area. This is a motor component. motor component, Broadman area 44. So this is us very close to prefrontal cortex and the motor cortex there. So Broca's area, that is one. Then we have this is a motor component. We have a sensory component here. This is a Wernicke's area. This is a Wernicke's area. This component is a Wernicke's area. Okay, so now that's the second part of this thing. But you look at the arrows here. See, all the arrows are coming to this Wernicke's area from the somatic component, the primary. So yeah, everything is joining, the visual, auditory, everything. So that means Wernicke's area receive all the inputs and they will be analyzed and interpreted. Say, for example, if there is a sound, if any voice I hear, that the voice is interpreted and they are put into action here in Wernicke. This is the sensory part of the speech area. This is sensory part of the speech area. Now we have another area which connects this Wernicke's area with the Broca's area. This is the arcuate bundle that I will show you in the subsequent slides. Then we have one center here above the Broca's speech area that is for writing what is called Exner's area, and here degerence area. So that I will see in the next complex. Yes, I have this next. Here I have categorized sensory areas, motor areas. The sensory areas, this is a Wernicke's area. Then degerence area. This is degerence. The angular cortex. Angular cortex is the degerence area. This is a degerence area. This component. This angular gyrus. Angular gyrus is this is degerence area. Wernicke's area, degerence area. Then after that, this is the connecting link. This is the bundle going to the Broca's area. This is a Broca's area. So this bundle, this is an arcuate fasciculus or arcuate bundle. So that means whatever the information the Wernicke sensory component is there, it is carried to the Broca's area. This is motor. And I mentioned this is the Exner component. This is concerned with writing, whatever words we see. I will just come back and I will tell how that is happening. That is the Exner's area. So I repeat, we have 4 centers. One sensory side, Wernicke's area, degerence area that forms the angular gyrus, that takes up all the associative information from the visual, auditory, and the sensory, somatosensory components. And then we have the motor, that is a Broca's area, and Exner's area for writing. So all these, put them together, they form the speech centers. And these two sensory and motor components are joined by the arcuate bundle. When we want to repeat a word after hearing a particular word, so that means you have heard a particular thing and you want to repeat it. You want to repeat this thing. What are the things happen? So when you want to see, so the first thing is you have the auditory stimulus, that is the ears. They collect the sound signals, that is vibrations. The tympanic membrane. From the tympanic membrane, the ossicles, the bony ossicles. From the bony ossicles, we have the round window. Then that will open up. That will produce the vibrations in the scala vestibuli and the scala vestibuli, and the cochlear membrane is vibrated. Once the cochlear membrane is vibrated, that produces a sound that is carried through the cochlear nerve to the cochlear nucleus in the medulla. From the medulla, it will reach to the auditory cortex. So I have said so many things. I'm just trying to revise you the auditory pathway, almost auditory pathway. It comes to the primary auditory area because I have heard a word, that is the voice. So then if I say that the word is about the class for 2K19 batch, that is the 2K19 is the word. 2K19 is the word. So that means I hear that word and it comes here to the auditory cortex. Now the 2K19, if I just mention it, means nothing. It means nothing. I have to interpret what does it mean. So that is interpreted in the auditory association area somewhere here. From the auditory association area, it will go to the vernix area. Now the vernix area, it forwards it to the Broca's area through the arcuate fasciculus, through the arcuate bundle. Now the Broca's area tells those the vocal cords and the muscles which produces the articulation, they will activate that. And from here, the signal comes down to the centers of the whatever the cranial nerves involved. So they will produce the muscle contraction, the vocal cord contraction. So that is how I can repeat. Now you have said 2K19. Now I repeat that 2K19, but it involves so many steps. I have mentioned these steps here. The reception of the auditory signal first, then interpretation of the auditory signal here in the vernix area, then the planning of the whatever the choice of words, whatever I have heard, and to repeat that word, that vernix areas that is done here. Then it is transmitted to the Broca's area via this. Then that activates the skilled movements of these, the tongue, the vocal cords, laryngeal muscles, the pharyngeal muscles, and jaw movement. And that produces the appropriate articulation. This is what happens when we speak the heard, whatever we have heard. Now, if I come back, I will take another thing, the sequence of reading from a written word. If I flash, so suppose I have flashed you this particular slide. Say maybe I will just talk about only one word here, the sequence. Now, when you read this sequence, what is the first thing is, it is a visual signal. This visual signal has to form an image on the retina. From the retina, so many steps. It should reach the lateral geniculate body and then to the occipital cortex, area number 17. But area number 17 only understands words. That meaning of the words is given in the area number 18. So now it will come to primary visual area. Then after coming to the primary visual area, it goes to the visual association area. Then from the visual association area, so it will go to the limbic association area. So that means it tries to, because we are trying to interpret, this further goes to the angular cortex. From the angular cortex, it reaches the vernix area. From the vernix area, it is further communicated to the Broca's area via that arcuate fasciculus or arcuate mantle. Then Broca's area communicates this message to the skilled movements of the vocal cord, the laryngeal muscles, and oropharyngeal muscles, and the tongue. So they will be activated, and that produces this thing. But here, hello. So here, this is you are reading it, and now you will produce that sound. If I were to make the writing, how I will do that? Suppose you have seen the word sequence. You want to write it. So now if you want to write it, the first few steps are same up to the Broca's area. From the Broca's area, then it goes to Exner's area here. This is the Exner's area. And this Exner's area now will inform, from Broca's area, it goes to the Exner's area, and it will inform those hand and posture movements, so that there is a writing of the particular thing. So that is one of those areas that would be producing. So this is about a written word. I mentioned about regarding the even writing of those written words. Now the same thing I have taken it from Genong. And you can just see the number of steps, what I have represented here. This is starting with the lateral geniculate, that is the striatum there, number 1. then comes number 2 there, then comes the higher order of the visual cortex. I mentioned it is the visual area number 18, that is the visual association area. Then comes the angular cortex, that is the Wernicke's area, and from the Wernicke's area, the arcuate bundle to the Broca's area and to the particular whatever either speech or the writing centers. This is what we have that in that graph. Now, just to summarize the speech centers, we have the speech centers, Wernicke's area, Broca's area, the first important ones. The Wernicke's area is the sensory area, and the Broca's area is the motor area, and Wernicke's area is assisted or associated by the angular cortex, that is Digen's area, and the Broca's area is assisted by the exner area for writing. So now these the sensory and motor are connected by the arcuate bundle. So this is just a summary of those speech centers. Now it is not enough because speech centers are lateralized to a cortex. So that is only one of the cortex is taking the responsibility of the speech centers. And in that way, in a right-handed person, it is the left cerebral cortex which is dominant, which is taking this responsibility. And the right hand, don't think that right hand is silent. It is doing some other purpose. I will discuss about that. But usually in 95% of the cases, the right-handed person, it is the left hemisphere, is the dominant hemisphere, and where these centers are located. Suppose what happens, the parents, whenever the child is learning the language in which he is a left-handed person, they try to force him to use the right hand, because basically he is a left-handed person and he may result in a certain amount of a stammering or a stuttering or a speech disorders. So that means it is not his natural the pathway for a neural pathway, which otherwise he may manifest in all of his life about this stammering. Then moving further, this is when I say the dominant hemisphere, now I am trying to differentiate between the left hemisphere and the right hemisphere. Now, the left hemisphere, we have the language, the speech, the thinking, that is semantic organization, then recognition, that is self-identification, self-consciousness, and self-building, then problem-solving ability, and reasoning. It is a mathematical brain, it's a logical brain, and it has a lot of skills. That is the left hemisphere. Here is the language and the speech are situated. Whereas in the right hemisphere, we have the body language, the spatial processing, that means where we are, how we are, and the perception. And it is again the right hemisphere is associated with the memory recall, the facial recognition, identifying a particular object or a person, and regarding beliefs. And it's a musical, right hemisphere is a musical hemisphere. It try to understand the voice and the musical and the other non-verbal cues. So common, both of them, right and hemisphere, we have the common things: the word recognition, object recognition, voluntary behavior, memory formation, memory retrieval are shared by both the right and left hemispheres. Now, here I have written the schema for the exteriorization of the speech. One, I have just given the whatever I have mentioned, the spoken words, on the other side, the written words. I just mention you here the spoken words, the voice, the ears. First you hear it through the ear, then it reaches the auditory centers. I don't want to go to the auditory pathway there. Then auditory speech center is there. Then it comes to angular gyrus, then Wernicke's area, arcuate fasciculus, the Broca's area, the motor action. That is about the spoken words. So now, in case of written words, it is the sight. That means you are seeing a word, that is eyes, the visual center, visual association area. Then after the visual association area, we have the angular gyrus, the Wernicke's area, arcuate fasciculus, Broca's area, motor action. Here, anything lesions after 3 and 4, that is 3 and 4 is the auditory center and auditory speech center, that is visual center and visual association area, that would result in either word, what is called a word blindness in both the situation. That means they will not be able to understand the spoken words on this side, that is in the spoken words, or they on seeing, they will not be able to understand the spoken words on this side. That means this is a dyslexia. This condition is a word blindness or a dyslexia. So now, if the lesions are happening after or on or after Wernicke's area or after, that would produce aphasia. And here in this side, it produces agraphia. That means on the written words, it produces agraphia, and on the spoken words, it forms the aphasia. Now, just revising the centers one more time. We have the Broca's area here, Wernicke's area here. Again, I am really happy to see so many arrows. That means the importance of the Wernicke's area in reference to the speech. Now, move on to the speech abnormalities. We have a number of abnormalities. One, I will just mention the inability to speak is called aphasia. Aphasia is inability to speak or produce the spoken words. So now there are several of these aphasia. One is a aphasia resulting from the sensory component, that is a Wernicke's area, that is called a fluent aphasia. And the aphasia resulting from the Broca's and surroundings, that is a non-fluent aphasia. And if there may be aphasia which is because of the conduction, that is the transfer of the impulse from the Wernicke's area to the Broca's area, that is again another fluent type of aphasia. So that means there are aphasias because you know everything, but you cannot speak, and suddenly we all will have. So I have seen, I am not getting the word, and I want to explain. That is how you sometimes tell. That is called a anomic aphasia. That means you are not trying to recollect a particular thing. That is a anomic aphasia, not able to identify. So that is the problem with the angular gyrus, where that visual and auditory components are mixed. So then we have the another words, what I mentioned, dyslexia. Dyslexia is a word deafness or word blindness. So now we have, this is purely about the central component. In the central component, we have cerebellum. Cerebellum is very much important for the production or the muscle contraction. We have seen a number of disorders associated with the cerebellar lesions. You will see that there is a dysarthria. That means the speech is almost broken down. So that is a speech is not normal. So that means abnormal muscular contractions which are not happening in a way they are smooth and effective. So dysarthria, that is in cerebellar lesions. In case of basal ganglia lesions, what happens? These are muscle contractions are weak. Akinesia or hypokinesia is important aspect of the basal ganglia lesion, and you may hear, because if the person is not able to produce the sound, it may be called as a dysphonia. That means he has a production problem. So his muscles are not contracting effectively enough to produce the sound. And abnormalities in articulation. So like vocal cords, you may have the hoarseness of voice. Whenever there is a inflammation or congestion, you have the hoarseness of voice. So that is again a speech abnormality. So suppose if you have a rhinitis, a common cold, a nasal tone, so you will get that particular peculiar sound production. Or any paralysis of the pharyngeal or laryngeal muscles may end up in losing the voice. So these are some of the speech abnormalities. Now, I have just given here in this graph the explanations for all these. The motor aphasia, the receptive aphasia, that is a fluent, this is non-fluent. Anomic aphasia, I have mentioned about the details there. The global aphasia, that is another condition in which both the Wernicke's area and the Broca's area, they are damaged. So that means there is a global ischemia or whatever. So that is producing a global aphasia. There is involvement of both the centers. Then we have a primary progressive aphasia. This primary progressive aphasia is a degenerative. It happens in case of a degenerative disorder, and it is progressive. And slowly, they, especially in persons with Alzheimer's disease or other degenerative diseases, they will slowly lose their ability to talk, read, or write, and then comprehend. So this is only thing that we can help them to improve. Okay, so I have already explained all these things, but you have these things in writing. I will provide them in my slides. Now, this one, I'm just taking a little more time here because the fluent aphasia. So in the fluent aphasia, I want to say that the language comprehension is intact, relatively intact. Fluent aphasia is resulting from the Wernicke's damage. And there is this is also a part of the conduction aphasia. So now there may be a difficulty in finding an appropriate word, and he keeps on repeating certain words. So now what I am giving you, maybe I am giving you some website linkage, so that these all aphasias are there with the video clipping. I want that you just play them and you try to understand what they are. So this one I have taken it from the American aphasia group, and that would help you to understand what we are talking about fluent aphasia. So now I mentioned up here in this slide language comprehension. It is relatively intact here, and sometimes it is impaired in Wernicke's aphasia, and in conduction aphasia, because Wernicke's is proper. Wernicke's is in conduction aphasia, it is only the arcuate condyle is damaged. So that is why you will have the language proper. Here in Wernicke's area, language is very important and it's lost. So you can have these examples trying to go through those video clippings, and you will try to understand them. Then non-fluent aphasia is usually Broca's, that is a motor component, and the speech production is halting, and it is effortful, and he forces upon to speak something, and the grammar or getting correct word is also impaired, and he has limitations of speaking. So actually it is though everything other part he understands everything, but he cannot be able to put forth what he has understood. So in both the situations, the language comprehension is here. It is okay. In Broca's aphasia, the language comprehension is okay. But in case of a global aphasia, if you see the language, because it is also involving the Wernicke's area. Now, this is the center. I have just given you the, this is the, you want to go through this particular link I have provided. That is aphasia.org. Stories, different types of aphasia, and you play that, and you play each one of them, and you try to see, because then you will exactly know what we are trying to understand about, or what we are feeling about the Broca's aphasia, or Wernicke's, or a anomic, or a global aphasia. A very beautiful video clips are there. So now this is the table showing the different aphasias, and their features and the cause. So I have put them all together. It is a summary of all of them. So that means I have mentioned Broca's. It is non-fluent, the lesion in the frontal lobe. Wernicke's, without any meaning, fluent, and temporal lobe. Global, both, widespread. So nominal, that is in the angular gyrus, especially the inferior parietal and the temporal gyri. So inability to name a particular object, or a person. The motor aphasia is difficult in uttering individual words. That is again the Broca's area, or the pathway between a left speech center and a prefrontal cortex. Auditory aphasia, what we will say, it is these are word blindness. So motor aphasia and these are word blindness or dyslexic. This auditory and visual or dyslexic aphasias. Agraphia is inability to write, and again pathways I have mentioned already concerning with the Exner's center. Now, the keywords for today's topic, because they are important for your examination. One, please note down speech centers, Broca's area, Wernicke's area, Exner's area, angular cortex or degerens area, arcuate bundle, aphasias, types of aphasia. Maybe it may come as a short note, or you may get a fluent aphasia as a short note, or a non-fluent aphasia, dyslexia. You try to prepare these things that will help you and make you better with the speech, because don't ignore this. These are important topics I am trying to cover.